According to the Center of Disease Control, an estimated 2.7 to 6.1 million people in United States have atrial fibrillation. AFib can increase a person's risk for stroke by 4 to 5 times, and this condition contributes to an estimated 130,000 deaths each year. I am a medical assistant in a very busy anticoagulation clinic, and I am excited to share some information what we do to save lives. I will start with what anticoagulation stands for and its role in preventing the leading cause of death in our country. Coagulation stands for blood clotting. Anti stands for prevent. Therefore, anticoagulation means prevent blood clotting. Anticoagulant is a medicine used to prevent blood clotting as easy or as effective as normal. Some people call this blood thinners. However, it doesn't really thin the blood, especially to a blood clot that have already formed, although it can stop or prevent the blood clot from getting bigger. The anticoagulation clinic is a service provided for all the patient who is currently taking oral anticoagulants, specifically warfarin. Blood clot is a very important process to prevent us from excessive bleeding. Example, as soon as we get a scrape or a break on our skin, a special cell called platelets spring into action. Platelets sticks together like a glue, forming a clot, serves as a protective bandage on the injury to stop us from bleeding. However, if the blood clots form without any cause of injury inside our blood vessel, that can lead into a serious problem. Blood clots can clog our blood vessels and can lead our tissue to die, and that can cause a stroke or a heart attack. Blood clots from a large vein is called deep vein thrombosis. If it breaks and travels to our lungs, that is called pulmonary embolism that can lead into a life-threatening medical condition. As I mentioned earlier, majority of the patients that we see in our clinic have fast, irregular heartbeat, also known as atrial fibrillation. In our clinic, we test patients' blood by using a portable machine that determines INR value by a drop of capillary whole blood. It is a very simple finger prick procedure that results are available as little as 1 minute. Healthcare providers use INR or International Normalized Ratio to determine what's the right dosing of the patient. In healthy people like you and me, an INR results of 1.1 is considered normal. For patients who is currently taking warfarin, an INR level of 2.0 to 3.0 is generally an effective therapeutic range for them. If the INR level is above the therapeutic range, it means your blood is really thin and can put the patient potentially to unnecessary bleeding complications. An INR level of lower than the therapeutic range means your blood is really thick and can increase patient risk for having a blood clot or can increase the blood clot from getting bigger. Warfarin is a very unpredictable medication and can be dangerous if not monitored or managed. If you take warfarin, you need to have blood tests on a regular basis to see how quickly your blood clots. Even a slight variation, such as illness, activity level, and diet can alter the effectiveness of warfarin. If you or your family member is taking warfarin, I hope my video make you aware of how important anticoagulation direction is. To have the best outcome of your anticoagulation therapy, you should always monitor your daily or weekly behaviors, in particularly with diet, activity levels, illness, change of medication with your primary care provider, specialist, or the anticoagulation pharmacist. The aim of anticoagulation provider is to get the right dose of warfarin to your blood does not clot easily as normal, but not so much warfarin as this can cause bleeding problems. Always remember, prevention is better than cure. Thank you.